Hi class, this is my presentation on data sets and information management to provide informed health and quality healthcare. Having access to digital health records is an incredibly useful tool, especially when monitoring vulnerable populations, and can greatly reduce medical errors in care delivery. Healthcare data sets are an important source of information for understanding health disparities and addressing health inequalities in patient populations. Most healthcare data captures information about services that an individual patient receives during encounters with the healthcare system. Healthcare data sets can come from many varying places. Creating a common format allows institutes to collaborate. Healthcare datasets can include a vast amount of medical data, such as statistical and financial data, insurance data, and demographics of a specific population. Datasets are a legal record that is used to gather a patient's assessment, which then this information is organized and used to help identify a problem and develop a plan for that patient. There are several different types of data sets. For example, we can use HIPAA. Another one would be HIT. And another example would be EMR. HIPAA is the Health Insurance Portability and Accountability Act. This is the core set of healthcare information and technology data which regulates the use and disclosure of personal data. We, of course, as nurses, use HIPAA daily. And it's this that we use to keep patient information confidential. HIT, or Information or Health Information Technology, also known as EHR, is data that is used to track trends in a better and more timely manner using something called a decision-making tree. A decision-making tree is a nursing process which uses various stages or steps that a person follows before making a final decision. These stages include assessment, diagnosis, planning, implementation, and finally, evaluation. Analysis of data from EMR can identify early symptoms useful in predicting outcomes in patients. This data analyzed includes things like vital signs, laboratory results, gender, and age. An example of this would be the sepsis predictor, which uses different various vital signs such as elevated heart rate, temperature, or other such data, and then helps us to predict a patient's possibility of getting sepsis. Medical data can be shared in an integrated format within an infrastructure whereby that data is collected and reused for multiple purposes, which then supports the assimilation of new knowledge into a decision support tool, such as an alert of a new drug contradiction, or something as simple as a new allergy. Today's medical data needs to be integrated and accessed intelligently to support better healthcare delivery. Network of knowledge sharing. Measuring and monitor data digitally helps us to compare information and improve patient care. Systematic analysis of data can help create patterns, which then helps clinicians to make more informed decisions regarding patient care. An example of this would be looking at all of the different labs and values, and then creating a patient care plan. In summary, patient safety is a cornerstone of high-quality care. Much of the work defining patient safety in practices that prevent harm and have focus on negative outcomes, such as mortality and morbidity. Nurses are critical to the surveillance and coordination that reduce such adverse outcomes. Quality of care is also a key component of the right to health. Delivering healthcare that minimizes risk and health and harm to service others, including avoidable, preventable injuries and reducing medical errors. In summary, providing an accurate patient history, diagnostic results, and more that allows clinicians to decide on a treatment plan. We can access information from other providers, exchange information between facilities, which then improves the quality of healthcare for our patients. By using data sets, we are able to see what medications may have been started, or a physical therapy note, for example. Having an electronic connected healthcare system helps by sustaining information data sets and provides managed and safe and quality healthcare. Having access to medications, diagnoses, and other such data sets helps us to provide safe and quality healthcare. Well, class, I hope you enjoyed my presentation on data sets and why it is important in the management of our patients and how that provides safe and quality healthcare.